Hello, my name is Andrea Vasquez, and I will be giving a brief presentation on a client that I've been working with throughout the semester. Her name is Mrs. J. Mrs. J is a geriatric patient who lives full-time in a freestanding Alzheimer's and dementia care facility. This particular care facility is specially designed and staffed to meet the needs of patients exhibiting all levels of memory impairments. The facility is designed to look and feel just like a regular home would. This is done in order to make the residents feel as safe and comfortable as possible. It includes four households secured and joined together. There is even a kitchen, dining room, living room, backyard, and personalized bedrooms. Now, the student clinicians that I participate with in this particular area we are in a unique situation at this facility. We provide group therapy to patients of varying types and severities of disorders. Due to this, we are not provided with specific case histories or information regarding our patients. However, according to the facility, Mrs. J currently presents with stage 1 dementia. This is evidenced by her ability to retain insight to her situation, ability to answer yes or no questions, WH questions, and her ability to maintain short conversations. According to the Alzheimer's Association, dementia is a general term for a decline in mental ability severe enough to interfere with daily life. Alzheimer's disease is the most common type of dementia, and it accounts for approximately 60 to 80% of all dementia cases. It is important to keep in mind that dementia is not a specific disease. Rather, it is an overall term that describes a wide range of symptoms associated with the decline in memory or other thinking skills severe enough to reduce a person's ability to perform functional abilities. We will discuss the various signs and symptoms later in this presentation. Now, dementia is caused by damage to the brain cells, which does not allow them to communicate properly with each other. As a result of this, areas such as thinking, memory, and emotions, in addition to other areas of cognition, may be affected. Because our brain is so complex, damage to different areas of the brain could have different implications. For example, our frontal lobe assists us in judgment, reasoning, and personality, whereas on the other hand, the temporal lobe is used for auditory discrimination. Therefore, depending on where the site of lesion or damage is, various skills and abilities may be affected. Because of this, different types of dementia are associated with different types and severities of lesions. While in most cases dementia causes permanent damages to the brain that worsens over time, there are some thinking and memory problems that may improve when the condition is treated or addressed. Examples of these memory problems include depression, medication side effects, excess use of alcohol, thyroid problems, and vitamin deficiencies. The symptoms of dementia vary greatly, and however, at least two of the following symptoms must be present and significantly impaired to be considered dementia. These symptoms include memory, communication and language, ability to focus and pay attention, reasoning and judgment, and visual perception. Again, the types and severities of these symptoms experienced by the patient are dependent on the type of dementia that the patient is currently presenting with. Many dementias are progressive, meaning that symptoms start out slowly and gradually get worse. There are various scales used to measure the stages of dementia. However, the scale that we are going to be discussing today involves 3 stages: mild, moderate, and severe. In the mild stage of dementia, the patient may be experiencing difficulty recalling something that they just learned, difficulty with things that they have learned in the past, making decisions, or finding their way around once familiar places. This particular stage can last for years, and sometimes the patient may be able to live by themselves if they have a strong support system close by. The next stage is the moderate stage, which is the longest stage of dementia. This stage lasts for many years and is different from person to person. the patient's memory gradually gets worse and they begin to exhibit more trouble with language and thinking overall. The final stage is the severe stage of dementia, where the patient may no longer be aware of where they are, remember their life history. Furthermore, their physical abilities are also affected, and they may not be able to carry out simple tasks. It is not uncommon for patients in the late stage of dementia to be bedridden or to rely a large majority on wheelchairs or other means of assistance in order to get around. Now, due to the unique situation that our student clinicians are presented with at this particular facility, we did not feel that administering a full assessment was appropriate for our patients. Our patients frequently become fatigued and frustrated when presented with long and complex tasks. Therefore, we decided to administer informal assessments addressing all areas of cognition. These tests included sub-tests from the Source for Safety Cognitive Retraining for Independent Living and naming cards from cats. For Mrs. J's assessment, I administered sub-tests 1 and 3 from the Source for Safety Cognitive Retraining Manual. Mrs. J was able to answer 10 out of 10 questions correctly without any insistence needed from myself. These questions included scenarios such as, what would you do if you smelt fire in your home? And Mrs. J was able to independently state to me that she would then find a phone and call the fire department. In the next section, I administered picture cards from cats to Mrs. J. She was assessed in the areas of expressive and receptive language. In order to assess expressive language, I simply presented Mrs. J with the picture card and asked her to name what the card was presenting. These picture cards included sofa, house, bowl, etc. Again, Mrs. J was able to name 10 out of 10 cards independently with no help from myself. For the receptive portion of this, Mrs. J was then presented with 2 or 3 different cards and then asked which would you types of questions. For example, Mrs. J was presented with a bicycle and a lamp, and she was asked which gives us light, and she was able to successfully state that a lamp is what gives us light. She was able to answer 10 out of 10 of these types of questions independently. In terms of therapy approaches, myself and the other student clinicians address the areas of cognition, attention, and expressive and receptive language, sequencing, and rote memory. In order to address expressive and receptive language, we address activities that include categorization, WH questions, and in terms of sequencing and rote memory, we frequently practice days of the week, months of the year, numbers, and alphabet. Throughout our various activities, we like to incorporate different questions and hierarchies that require the residents to make certain associations during the tasks. Furthermore, we also like to have our residents participate in arts and crafts, which assists us with addressing following directions and fine motor movements. Throughout each session, the student clinicians are constantly there providing prompting and modeling for each of the patients.